Welcome to In Your Neighborhood. I'm your host, Chris O'Rourke, as we continue our series, Conversations on COVID-19. And we've already talked a lot and heard a lot about the toll that this crisis is taking on healthcare workers. And Geisinger has come up with a unique way to help them deal with it. And joining me now is Dr. Charlotte Collins from Geisinger. She is a psychologist. Welcome, Dr. Collins.
Thank you. It's great to be here.
Okay, we'll start off real quick with a question I've been starting just about every interview off with. And what was your reaction back in early March when things started to head south because of this coronavirus?
Well, I think that we were in what I think most healthcare systems were in. What do we need to do? How do we get prepared for this? And I think that our system's done a good job of preparing for what's coming. And one of our important preparations is how are we going to take care of our people as they go through this? Because we knew that if this came out like they thought it would, that we would need to be very mindful about our people and making sure that they make it through this healthy and well as all our patients that we care about deeply.
Now, the program is called RISE, and explain what that means and how you came up with the term.
Okay, so it stands for Resilience in Stressful Events. There's more than one of these across the country. It's really what's called a Care for the Caregiver program. And what that means is that it's focused specifically on events and situations that cause distress for our caregivers who are taking care of people in our hospitals and throughout our communities. And it's designed to bring peers together to help someone who's struggling a little bit or has had a bad day or is upset or saddened by losses in our system or difficult things that have happened to patients. Because while the patients and their families are most impacted, our caregivers who take care of these people become very invested in them. And so when we lose a patient or a patient gets sicker or there's not much more we can do, then we're also impacted because we've become part of that family during caring for that patient.
Now, healthcare providers deal with death not too often, but it seems in this case like it could be often. I don't know how many cases and how many deaths there have been at Geisinger, but does it seem like they would need it more at this time?
Well, I think that the answer to that is they need it at specific times. So when there's been, for example, a big trauma where a lot of people come in, when there's been an unexpected death, somebody didn't get well, we knew coming in that this COVID was likely going to be stressful and maybe for a long time. And so while we had been working on getting this program going for some time and hope to launch it later this year, we turned around and launched it in 3 weeks because we knew we needed it soon.
We've heard that in many occasions because it seemed like even though there was a pandemic plan in place at Geisinger, that even and other people we've talked to said, boy, they really had to quickly turn around and produce on something. And that seems to be the case here as well.
Yes, absolutely. It was part of the crisis planning. But all of a sudden, you begin to look around and say, wow, what do we need? And how quickly can we get that together? And I just have to say that this program has been so well supported by our staff and all of the people that work at Geisinger. We had over 100 people nominated to participate and volunteered to go through training. And so we have a large group of peer supporters looking out for their colleagues and friends.
So what does the training involve, and what do these peer supporters do?
So the training we had to do virtually. It's one of those things that we're all doing things virtually, like right now in this interview, that we had to quickly shorten the training and get just the key components out of that and deliver it in multiple trainings where people got basic information about how the program works, basic skills in how to approach and work with and help someone who's in distress, and what they needed to do in terms of tracking all of this work. So it was pretty quick up and running. So the training got shortened a little bit from what it might have been else elsewise, and how we would have done it in where we had more time, I should say. So that's it. And what they do really is 24/7. We have people available if someone wants to call. So if you're at work and you're struggling, if you go home and you say, "Wow, that was really a bad day," and you believe that talking to a peer might help you, then you Tiger Text, we have that, or you call in, and we have coordinators who connect you with people in your area or similar roles to yours. And we get those people connected whenever that will work for the person that needs it. And then they have a conversation. And in that conversation, they're supportive. They're seeing what that person needs, trying to meet those needs. And then we have all these additional resources that the peer supporters are aware of that they can let those people know about in case they feel like they need more help.
Are the volunteers healthcare providers, or they come from a broad array of backgrounds?
They come all the way across our system. So some of them are providers, we have nurses, we have administrative people. The real issue that we paid attention to is who would be good at this, who had high levels of compassion and empathy, who really wanted to be involved. And so we had managers and leaders nominate people that they thought would be good, and then we approached those people and asked them if they would like to participate. And so it's across. We have respiratory therapists, we have all kinds of people who volunteered to do this. And so because we have opened up this to everyone, there's a lot of front lines here. It's not just the doctors that are in the ICUs and the emergency rooms. We have our entire environmental services group who are cleaning up and sanitizing everything. We have all kinds of people delivering food to our patients, taking care of people. So, for us, a lot of people are being impacted. So we wanted people across a lot of roles that to help out when we needed it.
So are the main things people are dealing with right now are stress and anxiety? Are they the main things? And does it come from being just in a shift for a long day?
I think the stressors are multiple. So first of all, it's a physical toll to wear all this PPE and gown up and dress up and ungown up and do all of that we need to do to take care of patients. And the way we're used to taking care of patients has changed, right? So we're doing things differently. So it takes more energy to just do the things you normally do. So that's sort of from a physical standpoint. But emotionally and mentally, it's challenging to be in with patients who are very sick. And unfortunately, because of this virus, they can't have their families around them. And that's heartbreaking, actually, to watch. And of course, our teams are doing everything they can to fill that void. And we have virtual connections for people so that they can see their loved ones. But I don't know, if I'm sick, I want my family around me and in there. And unfortunately, this virus has changed the way we handle that.
Is the isolation, the healthcare employee goes home and is isolated at home potentially? Is that a factor as well into how they deal with their day?
Yes, I think that, guess what? We're all frightened too of this virus, and many of our people are directly exposed to that. Now, we have our PPE, but they're directly exposed, and they're worried about getting the virus themselves, and they're very worried about taking it home to their families. And so these are very smart people. And so they work really hard to decontaminate, to go home. Geisinger has also offered people who don't feel safe going home, maybe they have someone at risk, have opened up other areas for them to stay so that they don't have to go home if they're worried about that they may have been contaminated. And of course, we're quarantining people that we're worried about as well. And if they can't quarantine at home, we're providing other space for them to do that.
And a lot of times being quarantined by themselves, they get a lot of pent up frustration and they get the anxiety as well.
Yeah, it's pretty hard, especially if you have kids, to explain to a young child why they can't hug you. and why you can't talk to them and why you can't be in the room with them. And I've talked to several people who've been in that exact situation, and it's really heartbreaking and emotional to go through that and not have your normal supports in the normal way that you are used to.
Are any of these feelings they're dealing with, are they immediate, or will they be short-term feelings? Do we know yet whether they'll be long-term, or does increased exposure on a daily basis to patients with COVID, does that just build things up?
So that's an excellent question, and it's kind of a complicated answer because we all have resilience and ways to cope through this. So it depends on what we're exposed to, how we deal with that, and how long it goes on. And you're exactly right that this is probably not going to stop at the end of whatever the end of this is, which I'm not sure what that is anymore. But we are very concerned about long-term chronic stress and stress injury from that. That's clearly in the literature. We talk about that with a lot of post-traumatic symptoms. And guess what? Healthcare workers are some of the bravest, strongest people you'll meet. So they also don't usually ask for help, unfortunately. And so they tend to soldier through and press on and do what they need to do to take care of everybody else. And so it may be for some people that it won't be until this settles down and after some of this is passed that they begin to realize the impact it has had on them. So we are going to stay with this program and with our people across time and make sure everybody is okay, not just now, but pushing into the future as well.
Is the unknown a factor too? Because they go in there, do this day to day to day. They don't know how much longer they're going to be dealing with that level of stress. That has to be a factor as well, I would imagine.
Yeah, the uncertainty of all of this is really difficult. I mean, for our whole community, right? We don't know when things are going to be safe. We don't know how safe things are going to be. We're not sure how to measure safety out there. And so I think this putting one foot in front of the other and doing day after day after day, sometimes you just have to look at it one day at a time, and not knowing when the end is coming is exhausting in another way.
Do you know offhand how many employees have reached out for help?
So we have had quite a few. We have multiple ways to reach out for help. So at the Center for Professionalism and Wellbeing is one area. The RISE program has just started in the last few weeks. So that's just beginning to ramp up. But I will tell you that we are not just doing the reactive thing. We are proactively talking to our teams, telling them what to look for, telling them how to take care of themselves, giving them ideas and advice, encouraging them to reach out. And so we think that some of that work that we're doing hopefully will prevent people from being upset. I just was on a call right before this interview where I was talking to a leader who said that one of her people was listening to a presentation that I gave yesterday and came into her didn't come into her office because none of us are in our offices, called up her leader and said, I watched this presentation and it made me really think, and I really do think I need to take a day off because I need some time to process all of that's been going on, and I haven't been taking that time to do that for myself. So these kinds of things I think really help us to bring awareness and for us to focus on taking care of ourselves that may preclude some of the things we're worried about.
How do they know how to reach out? How do people reach out to the RISE program?
Yeah, so they do. Boy, we're publicizing it. And thank you for having us on to talk about it. I'm sure some of them will learn about it here. We've been publishing this all across our system, trying to make everyone aware. And there's two ways. We do have a phone number. We also have something called Tiger Text, which is how we communicate on our phones with each other at Geisinger. And so they can Tiger Text into our peer support program and get immediate response.
Now, is this a program that, once this is over, which hopefully will be soon, that you would expand or extend just to handle any kind of traumatic experiences across the healthcare system?
Absolutely. this is one of those opportunities to do something that we needed to do all along and that we have been working on, but that we got rolling really quickly as a result of the coronavirus. And we absolutely will move this forward and deepen it and make sure that we continue it. And hopefully more people will know about it and will feel like it's a good program to reach out to. So we're excited that this is going to be with us beyond coronavirus.
Okay, so we end all of our interviews, and we will again this time, by asking the person we're interviewing, how are you handling this personally?
Well, thank you for asking that. I think I'm doing okay. I'm making sure I'm paying attention to my well-being. I am working from home, as you can see, most of the time here, but I am constantly in touch with lots of people. This work is so meaningful to me. I feel so connected with everyone in the system. I'm meeting lots of new people. I'm getting to know lots of people I hadn't met before. I feel like I'm making a difference. People are feeling cared for. And so that is really keeps me going. It's motivating to me to do this work.
Okay, Dr. Charlotte Collins, a psychologist with the Geisinger Healthcare System on Geisinger's RISE program. Thank you very much for joining us.
Thank you again for having us. And can I say one more thing?
Absolutely.
Okay. Thanks to the community out there who has reached out and been so supportive of our providers and healthcare workers and teams. That makes a huge difference to be recognized in your community. And I just have to say, the communities that surround our hospitals in Geisinger have been amazing and wonderful. So thanks to everyone who does that for us.
And thank you for all you do, Dr. Charlotte Collins. Thank you for joining us today. And we will be right back.